welcome to Mad Medicine with Miss P. I'm calling it Mad Medicine not because I'm crazy, but because I'm angry. So I'm hoping that the more I can teach and explain to you all why I'm angry, the less angry I'll be, because you too will know why I'm so upset. So all my previous students, as well as current-ish students, have been asking me for a while to do this YouTube channel for the little things that I teach about medications or assessment and that sort of thing. So here you go. Y'all have been asking long enough, so here it is. I'm going to try to upload every Tuesday if I can, and we're going to talk about an array of things. As much as I can possibly get into anything I've ever taught in the past, I'm going to try to teach you. So you'll have these videos to rewind or to slow down because I talk too fast. I know, I'm working on it. So we're going to go through vital signs, assessment, diseases, anatomy and physiology, all the NANDAs, all the care plans. I'm going to try to go into detail, and I've got a whiteboard that, I can draw out things for y'all. This is just kind of the introduction, so I'm working on lighting, and there is no editing. I don't have a camera. This is just from my phone, so I'm going to do the best I can, but a lot of these things aren't going to be anything you need to watch. It can be something you can listen to as you're driving to clinical, driving home from clinical, home from school to school, especially for those of you that have a long drive. I'm going to try to go over everything as much as I can, things that are going to make you a better nurse, things that are going to make you a safe nurse, things that you've been confused about up until now. So I'm going to try to be as specific as possible without driving you too crazy, getting into too many details. Each video I'm going to try to keep maybe to 30 minutes so it doesn't overwhelm you, because I know that my attention span is about 30 minutes. So we're going to go through all of that. I want to talk about some skills, how to write down orders, how to take orders, how to argue with orders, how to do IV push medications as well as medications in general. I'm probably going to do videos on literally specific medications. Like, we can talk about just calcium channel blockers in one video because they're that important. I'd like to try to condense these things, but make them clear so you all can be confident, competent nurses that will make boards a breeze, as well as being a nurse on the floor, knowing what you're doing and not having to ask questions or be uncertain or confused or nervous about doing something because you were told to do it, but it doesn't make sense to you. I don't do anything that doesn't make sense to me. I will argue with a doctor, with a nurse, even if my supervisor, if I have to, if I don't understand why we're doing what we're doing, or if I feel like it's not what's in the best interest of the patient. So we're going to go through all that. My disclaimer is not that this information isn't factual, or that there's anything argumentative, because it's not. 26 years I've been doing this. A good portion of those years I've been paying attention. So I'm only going to teach you what I know. And what I know like I know like I know. What I don't know, I'm not even going to touch on. If you have questions I can't answer, I will refer you to somebody else or see if I can get answers to it. But if it's something I don't know, something I don't specialize in, I'm not going to go over it. I'm not going to get deep into vent settings in ICU. I don't do that. I never have, never gonna. Things that I know, I'm going to teach you in great detail. I've been a nursing instructor for almost 15 years, and these are the things that I know as LPNs you need to know. Medications and skills and charting that we're going to get into, all nurses need to know, and I will be glad to teach you anything I want. I'm assuming most of these are going to be previous students that kind of got word that I'm finally doing this, maybe future students if the school refers to any future students that want to watch these videos. If it does get big enough and anybody else is watching, I'm just going to give a little shout out to haters. Don't bother, just click out. Anything you want to argue about or be mean about or give me a hard time about or insulting, don't. I'm my own worst critic. With a nose like this, I'm used to all kinds of critiques. So don't bother. I'm not going to bite. If anything, I'm probably going to have either my husband or my son read comments, and anything that is has questions in it, anything that I can help you with, I want to help. That's the only reason I'm doing this video. I'm not interested in monetizing anything. I don't even know how that works. I don't even own a computer. I know, gasp, in shock and horror. I know I don't have one. I clearly don't have any correct lighting. Gonna work on that too. I can online order like nobody's business, so I am gonna get some stuff to help. And I'm thinking about ending each video with a Miss P pet peeve, which is something just in general, whether it's nursing related or not, that makes me want to put my pen in my eyes. Little tips throughout the years I've noticed may or may not even be nursing related, like elevator etiquette, stuff like that. Like if you work in a hospital with 8 elevators, you should understand how they work, and how if you keep hitting the button, I can't go down with my patient to the car. If you keep hitting the button, elevator doesn't know how many people are on it, stuff like that. So also, I want to give you the disclaimer basically that says, once you know this information, once you really understand care plans, medications, disease and disease processes, some anatomy and physiology in a little bit different way than you've ever known before, some of the ridiculous kind of old wives' tales that we're going to clear up, like anybody using the term blood thinner. Yeah, we're going to talk about that. Going outside in cold weather with wet hair can't get you sick. That's not a thing. So we're going to clear up some of those simple things, and then we're going to dive deep into a lot of other things. I want to go into great detail so you understand what it is, not just metoprolol is a beta blocker and it blocks beta. If you don't know what a beta is, or why we're blocking it, or what leads to the result of blocking it, then why use the term? So we're going to go through that in great detail. Again, any haters out there that want to be nasty, argumentative, or attack me in any way, I feel I should warn you. Some of my previous students may come after you pretty hard. They're fairly loyal, and some of them are a little scary. So I don't know that I would go full-fledged there. If there's something that you don't like or you disagree with, you can just click right out of here. Just unlike, unsubscribe, go to the next one, because this is not for you. This is for those LPNs and even some RNs that want to be the best nurse they can be. Nurses that don't necessarily understand what medications do or why they're giving them, what to expect, all the nursing considerations that are filled with ridiculous side effects and adverse reactions. Those are not nursing considerations. We're not doing that. I'm not going through that. That doesn't make any sense at all. Some of these patients have been on these medications longer than some of you have been alive. So if some of those side effects or adverse reactions were going to happen, they probably would have happened maybe before you were born. So we're not going to look for those anal leakage and anal bleeding with stool softeners. That's not a thing, right, Jen? It's not a thing. So we're not going to do that. So I really want you to learn, and this is my only reason for doing these videos, is so you really understand and you learn in a way that it makes sense to you. I remember nursing school like it was yesterday. I remember my LPN, I remember my RN, and I don't remember learning a whole lot during school. Your mind is reeling, you're trying to get ready for the next test, you got 1,000 things going on, you're learning a new language. I mean, like before you went to nursing school, have you ever heard of adrenergic? What does that even mean? What's that? How could that possibly mean anything? When you said stuff like, oh, my stomach hurts, and you're holding your uterus, you don't even know where your own stuff is, right? So we get that. So we're going to go through that. So my disclaimer is, once you learn this, you can't unlearn it. which means there may be a good portion of you all feeling surrounded, like maybe when you're at work, feeling like you could be surrounded by people who maybe shouldn't be doing what they're doing, or if they don't know what they're doing, maybe you can help them out. Because in my experience, not so much where I'm working now, that gang is pretty good at what they do, and we only do the one thing, so that's all you really need to know necessarily. But I've worked in many different facilities in a couple different states over 26 years with many nurses, and a very large portion of those nurses that don't know what they're doing. I've had to argue about holding medications. You know, the student and I go into the room to give medication, we check a vital sign and we say, okay, I'm going to hold this. And the nurse says, well, do you want me to give it? And I say, no, I don't want the patient to have it. It doesn't matter who pops it out of the blister pack and puts it in a cup and hands it to them. The patient shouldn't have it because of this reason. And as I'm arguing with the nurse, I'm kind of realizing, oh, she doesn't understand what the medication does. And when you're not taught, or it's not explained in a way you understand, and you just kind of told the one thing, that's sort of what you go with. And that's not how medicine works. That's certainly not how nursing works. I was fortunate enough to be kind of grab hold of early on when I was probably about 23 or 24, and a very intelligent anesthesiologist got a hold of me. Like most anesthesiologists, he was a 14-year-old child trapped in an adult man's body that giggled when you said certain immature things, but still, this guy, and you know who you are, walking encyclopedia, brilliant, knew a little about everything, and he taught me what I needed to know, and he explained things, wrote things down, drew pictures, made it to where I understood, and then I thought, oh, that's what that's about. And how long have I been doing it wrong? So the good news is it's not too late. You can learn the correct way right now, and I'm going to help you do that. And that's the only thing I want to do. That's the only thing I did as a nursing instructor. That's really the only thing I want to do as a nurse on the floor or talking to patients on the phone. I just want you to understand what you're doing and why you're doing it. And if it doesn't make sense to you, maybe you shouldn't do it anymore. We're going to go into great detail, especially, you guessed it, on blood pressure. That's right. I am known as the blood pressure police. Some people say it friendly and sweet, and some people roll their eyes and point and snicker. Either way, I don't care, because I am, in fact, the blood pressure police. I'm going to explain that to where you are going to be very surprised at how wrong it's been going for so long. How people literally don't understand vital signs. And because they are, in fact, vital, we're going to talk about them in great detail. So I'm going to try to make them short videos, hoping to not go over maybe 30 minutes so we can kind of hold your attention. And we're probably going to do these videos very subject oriented, so I'll try to stay on that one subject. I get a little squirrely and kind of down other avenues when things kind of click and go together, but I'm going to try to do this so you understand. And if you've got questions, I will be glad to answer them. I want to make sure you know what you're doing. If there's something that you heard otherwise, I can learn too. I have no problem with that. It's not my way or the highway. I tell my students that all the time, whether it's charting or assessment. If there's something that you found, then you don't know how to explain it. You know, there's a lot of things in assessment that can be very confusing. How to chart chest tubes, pacemakers, ports, shunts, fistulas, Foleys, rectal tubes, ostomies, urostomies, we know. Edema, I'm going to go into detail, great detail on how to chart edema. Drives me insane when doctors say bilateral lower extremity edema. That's what it says, BLLE edema. Like, oh, could you be more vague? No, it's impossible? Okay, just checking. Right. You need to know where it starts and where it stops so you understand the severity, how to grade it correctly, how to grade pulses correctly. We're going to go through all of it. If you come with me on this journey, when you sit for boards, you're going to drive home smiling, not crying. Now, I know most of you cry on the way home anyway, as I did, even though I passed both my boards the first time. It still maybe feels like you didn't. But I'd like you to have the confidence when you sit down to do that. So I'm going to try to get this out in time for all of my students sitting for boards in April or May, but we'll see how far we get. I'm going to try to do this on Tuesday and upload it, and we'll see how it goes or what kind of process it needs to go through. So and I'm planning on ending each of my videos with some very wise words that a pastor from my church that is now passed from brain cancer once said, and it really affected me and made really good sense in almost anything, any aspect of what you're doing and why. And it's simply this: face your fears, forget your failures, and follow your faith. And that, I think, will really help in almost anything you do, especially when you're caring for people. So this is Miss P's Mad Medicine, and hopefully I will see you next Tuesday. Sorry we have no editing. Maybe in the future I'll invest in something good. Thank you so much for watching. I hope I held your attention for the full 15 minutes. All right, y'all, take care. See you next.